This morning, we're going to talk about heart development. My name is Dr. Gakwaya. The audience are learners doing embryology. Objectives are to produce a doctor who is able to treat clients effectively and safely, pass examinations, do postgraduate, and be a long life learner. And the outcomes are to describe the heart, to appreciate the caudal encephalic rotation, to recognize truncus arteriosus, valvus cordis, ventricles, atrium, and the sinus venosus. To appreciate the septations, to appreciate the formation of foramen ovale, to recognize primary interventricular septum, to appreciate that the arches of the aorta form the major vessels of the heart, to appreciate tetralogy of Fallot. Methods I'm going to employ are PowerPoint presentation, illustrations, author's audio. Plan I will follow is introduction, folding, sections of the heart, rotation, absorption of parts, septation, arches of the aorta, and finally, abnormalities. By way of introduction, the heart is part of the cardiovascular system. Cardiovascular system is one of the first major systems to develop in an embryo. At the 4th week, the placenta is unable to meet the supply requirements of the rapidly growing embryo. The heart and the rest of the cardiovascular system develop at this time. Heart development. During the 3rd week, there is lateral and craniocaudal folding of the embryo and the 2 tubes fuse. And they form truncus arteriosus and valva cordis, which moves ventrally and caudally and to the right. And the ventricles move dorsally and cranially and to the left. The atrium, over time, it shifts to the right. The left atrium incorporates the 4 pulmonary veins, and they form the auricle and the oblique pericardial sinus. The right atrium absorbs the right sinus horn and they form part of the inferior vena cava. Sinus venosus. The left sinus horn recedes and becomes the coronary sinus, which drains the heart itself. The right sinus is absorbed by the right atrium and it becomes a part of the inferior vena cava. Slide 1 shows the lateral folding, which brings the 2 tubes together. Slide 2 shows the lateral tubes which fuse. Slide 3 shows the heart at 23 days and its parts. Truncus arteriosus, valvus cordis, ventricle, atrium, and the sinus venosus. Slide 4 shows the heart around 24th day, the truncus arteriosus, valvus cordis, ventricles, atrium, and the sinus venosus. As you can see, they are shifting. And around the 35th day, it shows the aortic arches, truncus arteriosus, the left atrium and the right atrium, the ventricles. Septation. They are made by endocardial cushions that grow. Atrium. The septum primum, which forms ostium primum before fusion with the cushion. And the septum secundum, which develops a hole within its wall, which is ostium secundum. These two form the shunt foramen of Valley, with directional blood flow from right to left atrium. Ventricles, the massicular area, which has a primary interventricular foramen, which is covered by a membrane. Then there is a membranous area. And the outflow. The endocardial cushion grows in the truncus arteriosus towards each other. The cushion twists and forms a spiral. It divides the blood flow into right and left. Slide 6 shows heart septations at 8 weeks. You can see foramen of Valley. You can see the mitral valves on the left ventricle. You can see the right ventricle, and tricapsid valves in the right atrium. Aortic arches and the arteries which are formed from them. The first and second arch forms maxillary, hyoid, and stapedial arteries. The third forms the common carotid and the proximal part of the internal carotid. The fourth forms the right subclavian vein, and the left forms the left subclavian part of the arch of the aorta. And the fifth, this may not develop, or if it develops, it regresses. The sixth, the right one, forms the right pulmonary, and the left forms the left pulmonary and the ductus arteriosus. Slide 7 shows the aortic arches. You can see the common carotid artery, the right subclavian artery, the ductus arteriosus, the arch of the aorta, external carotid. Clinical significance. See the tetralogy of Fallot, where there is overriding aorta, pulmonary stenosis, and hypertrophic right ventricle. And the atrioseptal defect, which is where illustrated. Ladies and gentlemen, thank you for listening to me.